everyone. Thank you so much for joining. I'm Dr. Marianne Abouillard. I'm a head and neck surgeon at UC Davis in Sacramento, California, and I'm very pleased and honored to be moderating this webinar this afternoon, Moving Forward, the Power of Exercise in Head and Neck Cancer Recovery. Thank you again so much for joining. Navigating the challenges of a head and neck cancer diagnosis can be physically and emotionally overwhelming. However, integrating exercise and movement into your care plan can play a crucial role in improving both your physical recovery as well as your emotional well-being. In this informative webinar, we will explore the transformative benefits of exercise during and after your head and neck cancer treatment. Whether you are currently undergoing treatment or if you are a cancer survivor, this webinar will provide you with the knowledge and the tools needed to incorporate beneficial movement into your daily life, helping you feel more empowered and resilient as you continue your recovery. Just wanted to remind you all that the webinar will be recorded, so if you need to leave early, we should have this available to you later. And if you do make it to the end, we do plan on having time for questions and answers, so please do use the Q&A box at the bottom of your webinar screen to enter questions, and we will get to them at the end of the webinar, if not throughout. Lastly, we will also have a survey at the end. We would love to have any feedback from you all and hear how you thought it went. So to begin, I would like to introduce you to our Head and Neck Cancer Alliance Ambassador, Christina Billmire. She is a U.S. Navy veteran from Sutter Creek, California. Christina has proven to be a resilient survivor, not only of her military service, but also after undergoing a formidable battle with stage 1 HPV-attributed tonsil cancer. She underwent an intense treatment regimen, including surgery, chemotherapy, and radiation. And throughout her journey, she endured physical hardships such as hair loss, altered taste, and swallowing difficulties. And this was all compounded by the fact that it was throughout the COVID-19 pandemic. Despite these challenges, she found strength in the unwavering support of her care team and a mentor from the Head and Neck Cancer Alliance. To her, survival means reaching out for support, surrounding herself with love, and staying active, walking several miles a day. And she also participates in the Alliance's Move-a-thon, demonstrating her commitment to resilience and recovery. So with that, I'll turn things over to Christina to speak with you all.
Hello, everybody. Welcome. Yes, I'm Christina Billmire. I am from Sutter Creek, California, and my journey actually began in July of 2020 during the height of the COVID pandemic. Prior to that, I was healthy and active before treatment, and then one day I discovered a lump on the side of my neck, went to my doctors and found out I had cancer, squamous cell carcinoma. Undergoing treatment, though, for me during that time was very hard. It was physically and emotional challenging. You don't have anybody to be with you. I had no personal support at the time during my treatments. So what I would do is I would go over to the waiting area where other patients were and engage with them. And I would ask, hey, how you doing? How you feeling? Because I needed something to get me motivated. I realized that moving around helped take away from getting overwhelmed, and doing that, I also realized I wasn't alone anymore. I saw that I had a purpose, it was a resense of a new purpose. So I just continued to talk with them and get some more, insight to stuff, and then I went on and did my treatments. I then increased my walking. I continued with physical therapy, and I, to help with the fibrosis in my neck because I had lymphedema and I had all these other side effects coming in. You have side effects of losing your taste, losing your ability to swallow. The physical therapist helped with those stretches and things for my neck. It was very important for me to do that. And, it was just really a good thing to have. And then I went on to continue to do more activities in my time here. Oops, I'm sorry. I missed one of my slides there. Sorry about that, folks. Now I am 4.5 years post-treatment, and I continue to maintain an active lifestyle through daily walks, stretching, hiking. I even do some chair yoga on the side. Occasionally, I engage in other activities that are outside my comfort zone, like you see here in this picture of me doing some zip lining. But the bottom line is, I believe that maintaining physical and emotional well-being, it provides a sense of tranquility and achievement, so through your own perseverance, sorry, my talking isn't the best either, in your efforts, you'll find that you're progressing along a path that continues to unfold. It's just how it goes. And like they said, survivorship to me means reaching out for support and surrounding yourself with loved ones to stay active. And the other thing I want to talk about is each April, the as an ambassador for the Head and Neck Cancer Society agency too, we participate in their annual move-a-thon for the Head and Neck Cancer Awareness Month. I really support this cause, as I have formed a team of my own to help fundraise and bring awareness to head and neck cancer patients, caregivers, and survivors. So if you're seeking a way to get motivated and you want to get out there and increase your physical activity, please join us. Join us in this move-a-thon effort. It aims to bring that awareness and demonstrates that all forms of movement and exercise are crucial to maintaining our mobility. So thank you.
Thank you, Christina. And I hope as many of you as possible can share that move-a-thon information and join us if you can next month. And next, I would like to invite Dr. Catherine Schmitz to speak with us. She leads the University of Pittsburgh Medical Center's Moving Through Cancer program and serves as a professor in the Division of Hematology and Oncology at the University of Pittsburgh School of Medicine. Her research focuses on technology-based supportive care treatments that incorporate physical activity to enhance outcomes for individuals with cancer. She's a past president of the American College of Sports Medicine and played a pivotal role in the development of the ACSM's exercise and cancer guidelines, helping to shape recommendations for patients undergoing cancer treatment. So it's an honor to introduce her, and she'll be speaking with us next.
Thank you very much. I'm delighted to be with you all this afternoon, evening, depending on what time zone you're in. And so I'm going to jump right in and say that I am actually the first author on the first guidelines that were published on the topic of exercise and cancer from the American College of Sports Medicine. These were published back in 2010. So we have had evidence telling us that exercise was useful in the context of cancer treatment and survivorship for 15 years. So this is not brand new information. That said, I like to show this slide in order for people to understand. I'm hoping that you can see my cursor. I'm not entirely sure that you can. But you can see sort of a small rise in the number of randomized controlled trials in the field of exercise and cancer. And we get to 2010, 2009, 2010, when we held the first American College of Sports Medicine roundtable. And you can see there's an exponential growth in the number of randomized controlled trials in this field of exercise and cancer after that. And, we did a second roundtable in 2018. And if we were to look today at the number of randomized controlled trials in the peer-reviewed scientific literature, it's over 3,000. So surprisingly, we feel like we can conclude a few things. There are enough studies for us to draw a few conclusions. And so the conclusions that we can draw, this is based on the second ACSM roundtable that was published in 2019, is that exercise is actually a true treatment for cancer-related fatigue. It probably feels a little contrary to your experience that you would get up and move when you're not feeling any kind of energy in order to feel better. But it actually is true that if you get off the couch for a little bit, your cancer-related fatigue generally does get better. We also know that exercise can be very helpful for sleep, quality of life, anxiety and depression, body composition, physical function, and largely due to my own work, breast cancer-related lymphedema. So I've talked to you about the American College of Sports Medicine guidelines, and that's from my home professional organization, ACSM. But we are not the only ones that have published guidelines stating that exercise is useful in the setting of cancer patients and survivors. The American Cancer Society has also issued guidelines, and most importantly, the American Society of Clinical Oncology, which is the professional organization that guides medical oncologists in the US and frankly around the world, has also issued a guideline. They're a very powerful political organization or policy organization. And I really love the quote in the ASCO guideline that says that medical oncologists should refer patients receiving chemotherapy to exercise programming to address common symptoms and side effects. So what do these guidelines say? What is it that we believe is true based on the science? So based on the science, we know that during treatment, patients are advised to do 90 minutes of moderate intensity aerobic exercise weekly and twice weekly strength training. And post-treatment, in order to reduce the risk of recurrence and mortality from cancer, we recommend 150 minutes a week of moderate intensity aerobic activity like walking and twice weekly strength training. So that's the science. And that's what I have been trained to tell you based on what is published in the peer-reviewed literature. And then cancer came to my home. So this is Sarah, and you see two pictures of Sarah, one in 2016 when she had a cute, pert little nose. And this was just a few months before she was diagnosed with stage 3 squamous cell carcinoma in her right nostril, which had gone through the septum to the other side of her nose. And so she had a complete rhinectomy in November of 2016, followed by a very intensive combined chemo radiation treatment period of about 2 to 3 months. And you can see on the right side a picture of Sarah as an 8-year survivor with, what is left of the attempt to reconstruct her nose. Hilariously looking, if you look carefully, it looks like she has a tail. Obviously, our dog was standing behind her at the time that this picture was taken. So the good news is that Sarah is doing really, really well. She's an 8-year survivor. The thing that was really, really hard for me, and the reason why I tell her story in talking to you today, is that I know the evidence base. I have done the research. I am a leading voice in the field of exercise and cancer. And I'm telling you that when Sarah was diagnosed, we both went into deer in headlights mode. I didn't think of anything that I could do for her. And, she went through all of her surgeries and recovery from surgery, which was really intensive. You can kind of see on her left arm where they took a great big, huge skin graft to try to remake her nose. We got all the way through that. It was actually months later when she was starting chemo radiation that, she said to me, "Oh, I'm so tired. I'm just so tired." And finally something clicked. And I realized I can help. I know something that can help. And so I started guiding her as to what kind of exercise I thought she ought to be doing. And we really focused on aerobic exercise. And I made her walk 30 minutes every day, whether she felt like it or not. And I'm very pleased to say that she got through chemo radiation without any dose reductions or dose delays, which I'm told is pretty unusual. And she thinks is because I was that mean lady that made her walk every day. Only she didn't say mean lady. You can guess what she called me. And then because of my experience with Sarah, I decided that I needed to translate the scientific evidence base into lay language so that people could benefit from this. So I wrote a book for patients and caregivers called Moving Through Cancer. It's available out there in the world. For anyone who is listening who is an athlete, chapter 16 is for you. That is the chapter that includes the stories of 5 to 8, I can't remember exactly how many, athletes who have gone through cancer and how they dealt with their exercise as they were going through treatment. We also made a short film. You can take a picture of the the link there, or you can just Google within YouTube. You can go into YouTube and look for Moving Through Cancer, and you will find this 20-minute film that is narrated by Scotty Hamilton, who is a former U.S. Olympian figure skater and brain cancer survivor. It basically is an attempt to try to explain to people that exercise really is useful as they go through treatment and in survivorship. So now what would I say to you? I am a scientist. I have done many, many randomized controlled trials to show the benefits of exercise for cancer patients and survivors. But I'm also a caregiver. And I also lived through the process of head and neck cancer with my Sarah. And so my advice now, based on science and combined with real life caregiving, the first thing I say is that no one benefits from being on the couch all day. No one benefits from being sedentary all the time. We even move bodies when they're in the ICU. So the body is meant to be in motion. So move just a little bit more than you did yesterday, and you're doing great. Second, moving your body more and more often will help you to help your doctors to know when or if something is off. The analogy is that one of driving your car. If you only drive your car once a month and there's a new rattle or hum somewhere, or whatever in the car, then what is it really new? Do you know? You can't really tell because you haven't driven it for a month. But if you drive your car every day and there's some new rattle, you can go in and tell the mechanic, there is a new sound here, and this is what it sounds like. And anybody remembers the car guys, you can make the noise for them and they can help you to diagnose what's going on. Well, it's the same thing with your body. If you move your body regularly, then you can come in and, for example, you go for a walk every day and you can walk 3 miles in an hour. And then one day you can walk 3 miles in an hour and a half. Something's off, that you're fatigued, something's going on. If you have changes in your ability of exercise like that, you can report them to your doctor. And it's not uncommon that people can notice changes before the lab results would reveal that there is actually something to be paid attention to. On a day when you don't think you can move, try anyway. Stop after 10 minutes of moving and evaluate. Do I feel better? Do I feel the same? Do I feel worse? Unless you feel worse, keep moving. Finally, the type of exercise you should be doing is the type you will do regularly. Sarah was willing to do walking while she was going through treatment. And then after treatment, she was very angry about the whole experience. And so she got into boxing. So that was what was her thing. Do not get stuck thinking that because you're not doing the recommendation of what the science says you should do, that you shouldn't do any exercise at all. Don't let perfect be the enemy of good. Finally, exercise will absolutely give you a sense of control back to your life. And I wish that for you. I wish that for my Sarah. I wish that for all of us after the experience of cancer. So finally, what I go through in my book is the amount of exercise and what you really should be doing and what makes sense to do according to where you are in your cancer journey. If you are pre-treatment, work out as intensively as you can and as often as you can. You want to get yourself in the best possible shape that you can in order to go through the cancer journey. Post-surgery, particularly I can tell you from Sarah's surgeries, she would weep a lot from her wounds on her face. And that's when we knew that she was working out too hard, that she was doing too much. So you need to keep walking, but no lifting, no heavy lifting. And you want to make sure that you're really paying attention to wound healing and that the wound healing is progressing. During chemo and radiation, 90 minutes a week of walking, twice weekly strength training. If you're not willing to do the strength, fine, walk a lot. Post-treatment, build back to 150 minutes a week of walking. And the twice weekly strength training will help you to rebuild the muscle mass that you've likely lost in the process of chemo and radiation. Finally, ignore me if you hate walking and strength work. The better that you move doing something you enjoy than not move at all. Thank you.
Thank you so much, Dr. Schmidt. That was an amazing presentation. And I've been also really enjoying seeing everyone's chats on the webinar chat here. I'm glad everyone's staying engaged and asking questions. And please do not hesitate to put your questions in the Q&A as well, just so we can keep those organized, and we will get to those as well. Next, I would like to introduce Emma Schauberg O'Brien. She is a cancer rehabilitation and lymphedema specialist at UC Davis Health. She serves as the director of lymphatic therapy for the Center for Lymphatic Disease here. And through her clinical practice, her research, advocacy, and mentorship, she aims to enable the optimization of movement and wellness across the lifespan for persons affected by cancer. So thank you so much for being here, and I'll turn it over to her.
Thank you so much for having me, everybody. I really am honored to get to talk to you all today. So since I am a physical therapist and a lymphedema therapist, I thought that I might talk a little bit more specifically about the role of exercise and physical activity as it kind of relates to these two areas. So I am going to talk, and at points in time, we've talked about physical activity and exercise, and just to kind of explain like what's the difference between these two. So physical activity is really more of a broad term that encompasses just any kind of bodily movement that's going to expend energy. And then exercise, when we talk about exercise, it's really like a planned and structured set of repetitive bodily movements that are done really with the goal of improving fitness in a very specific manner. So commonly during survivorship, especially in the physical therapy world, we're thinking about like rehabilitation, which is this idea where we're addressing impairments or issues that you may have that you've developed during or after the completion of treatments. But what I also think is really equally important to think about is kind of this idea of prevention. And so this is where this concept of what we would say is like rehabilitation or pre-treatment, physical activity and exercise can really play an important role. So prehab is really meant to be a preventative exercise program that helps individuals prepare for surgery or other cancer treatments, where the goal is to help you prepare for the physical challenges of treatment, to be able to better withstand any post-operative or post-treatment inactivity and associated decline. And generally, I think as we've mentioned before, the more fit you and active you are going into treatment, the more likely you are to retain that higher level of function afterwards. Whereas rehabilitation or rehab is something you might be more familiar with, and you may have seen a physical therapist for. And that's really to help you recover from injury or surgery or other health conditions or different side effects of treatments. So it's more about restoration as it relates to physical and cognitive function, strength, mobility, balance, posture, flexibility, as well as like quality of life, trying to manage pain, fatigue, and just getting back to activities of daily living and restoring your mental and emotional wellness. So there are a lot of different types of professionals who would specialize in these different areas. So it would include individuals like me, so physical therapists, occupational therapists, speech language pathologists, and physical medicine and rehabilitation doctors who could all help with these programs. So when we talk about prehab, what is prehab and what is the role of it for head and neck cancer survivors? So multimodal, meaning like prehabilitation programs, meaning that they would include nutritional intervention, physical activity or exercise, and psychosocial support, I think is really crucial for head and neck cancer survivors. And so these prehab programs are kind of this like holistic approach that can help to improve treatment tolerance and accelerate recovery and then enhance overall outcomes. But despite there being kind of promising preliminary results, there's overall not a great amount of evidence that talks about the impact specifically for head and neck cancer survivors. So a lot of the studies and the recommendations are based on outcomes in other from studies in other populations, so other cancer survivors. But rehab programs should really try to include targeted exercises and engagement in physical activity that are going to address function and impairments in quality of life that we expect to be commonly affected by these treatments or known factors. And so just to give you an example, these are some different types of exercises that you might get in a rehabilitation program. It's not all encompassing, but you can see the areas of flexibility and range of motion and strength that one might be prescribed. So rehabilitation that involves physical activity and exercise during and after treatment is also obviously a very crucial role in helping you return to gain control of your life and return back to and restore function. So Dr. Schmidt kind of noted what the positive benefits that we have seen through research that exercise is known to have. So helping with physical recovery, physical function, psychological outcomes, and improving quality of life. And so because of this increased research, there's several oncologic societies that have updated their guidelines for head and neck cancer survivors, which all now include the formal promotion of physical activity. And something that I think is interesting to know is that along with the improvements that they saw from kind of more traditional physical activity and exercise interventions, which would be like strength training or aerobic exercise, like Dr. Schmidt was talking about, they also noted that both like traditional and alternative forms of physical activity like yoga or Tai Chi were shown to improve outcomes in head and neck cancer survivors. So it's kind of that concept of the exercise that is going to work for you is also going to give you the benefits. So because I am a lymphedema therapist and it is something that is very commonly affects head and neck cancer survivors, I wanted to talk about what it is a little bit. So lymphedema refers to this swelling that's caused by excess lymph fluid or lymphatic fluid in the tissues that's under your skins. And it's an inappropriate buildup of fluid that's due to kind of this blockage, if you will, upstream at the level of the lymph nodes or the lymphatic vessels. And so it results in the fluid backing up out of that into that surrounding tissue. So more commonly in other populations, you may see this in like arms or legs or like the chest or the abdomen. So it really can occur anywhere, but in particular, you may see it in the head and neck for head and neck cancer survivors. And so you get it because of damage or abnormalities from the lymphatic system. So in particular, this can include surgeries that would require removing lymph nodes or radiation for cancer that would then cause damage to those lymph nodes or lymphatic vessels. It can also be caused by scarring or related to other health conditions or exacerbated by other health conditions, including vascular diseases or obesity. So fundamentally, the risk of lymphedema, particularly for head and neck cancer survivors, will increase as a function of that lymphatic obstruction or damage. And so the more nodes that would be removed, lymph nodes that are removed, the greater the chance of developing head and neck lymphedema. And then the studies also say that the total dose of radiation or the number of days increase your risk of developing it as well. And what I think is helpful to know and understand is that lymphedema is not only external, meaning that you can see it, but you can also have lymphedema internally that would have that can affect your oral cavity, your tongue, your larynx, like your voice box, your airway, your throat. And so what would be kind of signs or symptoms of that? So these are general signs and symptoms, obviously swelling of your neck, face, tongue, or even inside your mouth, and change of appearance would help. A visible change would demonstrate that. Also sensations of tightness or heaviness, firmness or feel like hardening of the skin. And it can also contribute to challenges with swallowing or breathing, or even like moving your neck and limiting. It can cause limitations in range of motion. So I won't read through all the signs or symptoms that are on the other side, but kind of just to emphasize is that you'll note that as the signs or symptoms, as the stages progress, as it worsens, then you may also somebody may experience more internal symptoms, such as like visual or auditory impairments, so listening impairments or ear aches and things like that. So really what I want to emphasize is that if you notice or you would experience any of these signs or symptoms, that you let your healthcare provider know, because it's important to be fully evaluated by your healthcare provider and then seen by hopefully a lymphedema therapist. So I think it's interesting to know that head and neck cancer associated lymphedema has really historically been like understudied, underdiagnosed, and therefore undertreated. And that's why I wanted to kind of mention it today. There's been recent studies and looking into it, and they estimate that the prevalence is can be more than 90%. So more than 90% of head and neck cancer survivors may experience lymphedema. And so it really means that routine screening is warranted. And if you feel like you have signs or symptoms of it, to seek treatment. So how does this play into exercise and physical activity? So physical activity is actually very important for preventing and managing lymphedema. So exercise or physical activity works your muscles, which increases the flow of lymphatic fluid throughout the lymphatic system and helps to move it away from swollen areas. And it can also help you to maintain a healthy weight, because having a high BMI or being overweight can increase your risk of lymphedema. Keeps your joints flexible, maintaining and improving your range of motion, which is really important. But if you do have lymphedema, there are some things to consider. So you should wear compression garments as prescribed when you're being physically active or exercising. You want to monitor swelling with activity. And when it comes to exercising or weight training, it's advisable to do it in a slow, progressive manner with supervision, and to be trying to incorporate deep breathing exercises that help with the movement of lymphatic fluid during exercises and throughout your daily routine, to try to help to continue to promote the movement of lymphatic fluid. And these are just a series of references depending on all the, if anyone is interested to know of the articles that I was talking about.
Perfect. Thank you so much, Emma. Next, and certainly not least, we are going to have Chris Nolan speak with us. Chris and his wife, Robin, have called Fort Worth, Texas home for decades. And in the summer of 2010, Robin set her sights on training for a half marathon. Though both she and Chris were dedicated weightlifters, running was certainly a new territory at the time. But undeterred, they tackled the challenge together, and Chris emerged from the experience in peak physical condition. However, he began noticing a persistent swollen lymph node on the right side of his neck, and at first assumed it was yet another sinus infection. But when the swelling did not improve, he finally saw a doctor. At 49 years old, Chris received a life-altering diagnosis, HPV attributed base of tongue cancer. Determined to fight, Chris underwent 40 rounds of radiation with chemotherapy. He pushed through the grueling treatments, determined to continue exercising throughout. His resilience and story caught the attention of Hoka One, leading to his feature in their fall 2018 advertising campaign for the Kavu running shoe, a testament to his strength as both a cancer survivor and an inspiration to others. Chris continues a very active lifestyle of weightlifting and embracing Peloton workouts, and we'll have him speak to us now about his experience.
Thank you. Hello, everyone. It's an honor to get to speak to you today. When I saw I was speaking last, I tried to think of a topic that I could speak about that wouldn't have been expertly covered before me, and it turns out I was right. So I chose rest and recovery. And I know that first blush, that sounds like the exact opposite of what we've been talking about, but I truly believe it is vital to being successful in adding movement to part of your daily routine. We all know how to rest, but what I would like to do, what I really encourage you to do, is look at resting as what you do to get ready to get back to work. So what does that look like? Well, today is my rest day. If I weren't talking to you, I'd be sitting on the couch over my left shoulder watching either basketball or hockey. I can do that while I'm actively resting as well. And by actively resting, I'm going to think about what I did yesterday. Yesterday, my knee hurt a little bit, so I didn't go for a run. I hopped on my wife's Peloton bike and went for a long ride for me. And I also have to confess that when I hopped on the bike and clipped in, I didn't have a water bottle with me. I finished the ride and got some water in, but one of the first things I need to do on my off day today is to make sure that my hydration is squared away. That's not something you can get very far behind on and catch up quickly. So hydration is number one. Second thing I'm going to do is look at what I ate yesterday, what I've eaten today, make sure that I've refueled my body. I think I've done a pretty good job of that, but I am going to have a couple of snacks while I'm watching TV, and they're going to be lightly salted, something like this. The lightly salting is going to help me replace any electrolytes that I lost along with the sweat that was underneath my wife's bike yesterday. Thanks for the slide. So I've looked at yesterday. Next thing I need to look at is what are my plans for tomorrow? I think the weather's going to be nice, and if my knee will let me, I'd love to get out and do a quick run. And if the weather's really nice, I may extend it a bit. That makes hydration that much more important today. I need to get on top of that and make sure I'm hydrated well. If I do a long run tomorrow, now's the time to probably take in a few additional calories so that I can fuel that effort. Maybe mix in some potatoes, some proteins, bacon and eggs, something like that. I want to make sure that I'm getting enough fuel to get the work done when I hit the road tomorrow. So before I let you go, I do have three other things I want to touch on very quickly. First off is I'm 14 years out. I still have swallowing issues. Guys like me with swallowing issues, we don't accidentally get hydrated. It has to be front of mind. For you that are in treatment right now, it's always front of mind because you know what happens if you get dehydrated while you're in treatment. We're going to do that here as well. We're going to look at how much did I sweat yesterday, how much did I talk, and need to replace that, make sure that I stay very hydrated. Secondly, you definitely want to fuel your workouts. And I'm trying to lose 10 pounds right now. I'm sure there are people watching that are also trying to lose some weight. Not fueling your workout is the way to do it, is not the way to do it. There's nothing as frustrating as being 2/3 of the way through a great hike with your family or a great bicycle ride and completely run out of fuel. It's a rough ride back home. We can lose weight in other ways, but let's make sure that we're fueling our movement. It's going to improve your chances of success. And lastly, I mentioned earlier with the hydration, I do have some swallow issues. Getting enough calories to move can be difficult. I want to encourage you to never give up. If you try something and you have difficulty swallowing it, mark that down and try something else. Speak with folks that in your medical team, speak with survivors, get some ideas from them. If you use one of their ideas that doesn't work out, don't give up. Make a note to yourself and move on, try something else. Thank you so much for your time this afternoon. Stay strong and keep moving.
Chris, thank you so much. That was a great presentation, and thank you to all of our panelists. I do want to address some questions that have been coming up in the chat and also in the Q&A, and invite our panelists to please chime in and provide your expertise. Some of these questions have been answered to the individual, but I thought they were good questions that everyone may benefit from. Someone had asked, if there's a certain time of day that was best for getting your exercise in, if in the morning or the evening, or any recommendation related to that. So I wanted to see if anyone had any input. My response to that person, because I did respond individually, was really just whenever you feel most energized. I think just getting that exercise in is more important than trying to get it at a specific time of day. I know we're all on different schedules. We all have different responsibilities. So really just whenever you can get yourself energized and hydrated and get that either walking session in or strength training session, that would be best. Another question that Dr. Schmitz did answer back to the individual, but they had asked if there was a reason why there was more emphasis on the walking or cardiovascular exercise and only strength training twice a week. So just in case you missed her response, I was going to have her answer that again, please.
Yeah, so it's not actually de-emphasized at all. It's just that it says twice a week, so it looks like less time. But when you actually take the amount of time necessary in order to complete a strength training session, which could be 30 to 60 minutes, it actually ends up being about the same amount of time for aerobic activity. And frankly, there are subsets of the population for whom I would recommend that the first type of exercise to think about is strength training. If you've lost a lot of strength, if you've lost muscle, if you're feeling weaker after your treatment is done, strength training is the place to start. If you are aging, and frankly, who isn't aging, but particularly as we get into our 60s and older, we start to lose muscle mass naturally with aging. And so keeping muscle mass is hugely important to maintaining function. There was also a question within the Q&A, if I can, is all right if I just take one, about the immunological benefits of rehab. And I just want to be very clear that this is an exercise question. I do understand that there's a continuum between rehab and exercise and physical activity. But the evidence base here is really, really strong. People who are more physically active have more natural killer cells at rest, and their immune cell strength is better. So the activity of immune cells is better in somebody who's physically active. What we know is that that remains true all the way up to the point of running a marathon. If you start to get to the point where you're doing really high level activity for really long periods of time, you actually show a little bit of a dip in your immune function, explaining why a lot of people end up getting a cold after running a marathon. That no problem with that, but just know that your immune system is likely protected from regular physical activity, but not so protected if you're doing high level activity.
Thank you for addressing that question too. I thought that was a good question to get to for everyone. I know some others have had questions. Chris, since you had mentioned, hydration, someone was wanting to specify if there was a specific amount of hydration, 32 ounces or 64 ounces, or what you thought was appropriate.
Yeah, I typed him an answer, but I'll share it. We're all adults here. I check the color of my urine because if me and 3 other people go for a run, we all are going to sweat different amounts. The docs can help me out with this. What I was told is when you look in the bowl, this should look like maybe the juice of 2 lemons were squeezed in there. The darker the yellow and even getting into orange are pretty strong indications you're very dehydrated. You got to catch up. if you get behind, it's worth taking a rest day just to get caught up on your hydration because it does not get better until you do get caught up.
I think that's perfect. I did see a few questions regarding lymphedema, questions regarding, if having prior filler procedures would affect your risk of developing lymphedema. I don't know if you've heard of any association with that. No. No.
Yeah, so I saw a couple questions on lymphedema and risk. And so that for that question in particular, I don't know of an association between like cosmetic procedures, but anything would cause if it causes damages to the lymphatic system or if it causes temporary swelling, it could put you at risk for developing lymphedema if you have damage and then you get swelling again and you've had lymph nodes removed or you've had radiation subsequently. So I think it depends on the scenario a little bit and the situation. Someone asked about like how you tell a difference between if it's just I guess I would call it like transient swelling from after surgery, which is very expected that if you after surgery, you're going to have some temporary swelling, right? And then how do you know if it's lymphedema? So if you are having those signs and symptoms and they're persisting for some time after surgery, then or after radiation, you develop signs and symptoms, then I would say try to seek evaluation from a certified lymphedema therapist sooner, because if we can prevent it from becoming chronic swelling, then that would always be preferable. If we can catch things early, then we may prevent it from you having to deal with this as a chronic condition. So there is kind of that continuum at times where you may experience swelling that is not lymphedema, but we don't want it to become lymphedema.
Absolutely. And then someone had asked about using the Triumph head and neck compression garment, and they were wondering if they would need to use that daily for the rest of their life, or I guess just what have you seen? Sorry, what have you seen with other patients, and if they've had to use that long term?
That's a great question. It really depends on the severity of the lymphedema and the individual and how. So I don't have a great answer to that because it depends, and that's like a very common PT answer, and so I apologize. um, but yes, there are various garments for head and neck lymphedema, and so people may have to wear them. Some people have to wear them more frequently, and for a lifetime, in order to manage it well. And then other individuals may be able to move away from it.
Okay. And I'm picking on you, Emma. Lots of good questions. If anyone else has any experience with this too, please do chime in. But someone else asked about long-term radiation-induced fibrosis, and that, exercise and stretching and massage therapy help provide temporary relief, but the pliability of that tissue long-term has been more difficult. So is there anything that you've found, like hyperbaric oxygen therapy or any other treatments that you've found to be helpful for fibrosis in the neck or, from the radiation?
Yeah, that's a great question. The evidence base for those types of other alternative therapies, I guess I would say, I don't have good research on to kind of recommend alternative things outside of that. In physical therapy, we would use many of the interventions that you mentioned. Unfortunately, radiation continues to have side effects long term, and so the skin continues to change even after radiation stops. And so we do know that, and so trying to intervene and keep skin pliable and flexible, but there are certain things that we sometimes can't always change, and then so we work to try to modify what we can and try to improve quality of life, knowing that you may still have some restrictions.
Yeah, it's really, really tough. I know a lot of these side effects are long term and, may not even come on for months or years after your treatment. So it's definitely worth as much as preventative care as we can, with this exercising, for example, and with being as active as you can, whenever you can be. Someone asked about the Life Pro vibration machine as a form of exercise. I don't know if anyone has experience with that. I don't specifically know that machine. I think I know what you're talking about. And I would say that it's not the same as, your cardiovascular exercise or walking and getting your heart rate up and getting your body moving. But if anyone has any other input about the Life Pro vibration machine. No? Okay. But it sounds like, yeah, everyone's still wanting to get up and moving, so that's great. Does anyone recommend any compression garments for exercising or just at rest? Like whether it's, yeah, any compression garments?
Compression garments are definitely called for. Now, one of the things to say about compression that Emma didn't say, but I'm betting we'd be in agreement about, is compression should be well-fitting. And poorly fitting compression is actually worse than no compression at all. And so the difficulty is that if I tell this audience you have lymphedema, you need to have a well-fitting compression garment prior to doing your exercise, and then people are like, well, maybe I shouldn't exercise because I don't have the well-fitting compression garment. And then the next person says, I'm just going to go get an ace bandage and I'm going to wrap myself in an ace bandage. That's a terrible idea. So you actually do need to have a well-fitting compression garment. If you do not have one and you want to start moving, then go slow and progress slow. So you start with just doing a little bit of whatever you're going to do and make sure you're not having any kind of worsening of your symptoms of lymphedema. And then stop and let the body tell you whether that was too much, and then progress very slowly. That's the start low and progress slow is kind of the mantra for people with lymphedema, even with concussion. Emma, okay?
100%. Yeah, absolutely. It was perfect.
Emma, have you heard of mini trampoline as a recommended way to increase lymphatic flow and dry brushing? Do you recommend any of that?
Yes. So mini trampolines or rebounders are a common adjunct, I think I would say. It's not, when it comes to lymphedema therapy, it is not something that is normally a part of our therapy. But it helps to enhance the concept is that it helps to enhance lymphatic function and fluid. I don't prescribe it to individuals, but I do get asked about it for sure. There are other forms of exercise that are more well studied that are like lymphatic function exercises that I would generally recommend. And there's a lot of resources online that are very good resources for that. Dry brushing is also great. It is, I think it's important the type of dry brush that it is, and the pattern in which you're doing it. So being trained in it is very helpful. So I do use it with my patients. And it is also meant to help promote the movement of lymphatic fluid, but you want to be doing it in a specific manner, so that you're moving the lymph fluid in the correct direction and you're doing a good pattern. So there are some resources online for that as well, but I would recommend having somebody who is a trained therapist to show you how to do that and to be trained in it.
Perfect. And then related to the lymphedema, where do you recommend the compression garment going? Like what type of compression garment do you recommend for head and neck surgery?
So if you have head and neck cancer, related lymphedema, then the compression garment is going to be specific to where you have that lymphedema specifically, right? So you can get it in your face, you can get it in your head, you can get it in your neck, you can get it more in your shoulders. And so the garment should cover the area that you're having swelling and be and more to be able to move it in the direction that we want the lymphatic fluid to drain to. So I realize that's not a specific answer necessarily, but it depends on where the individual is experiencing those symptoms. So sometimes it's more so in the chin. Sometimes it has to be more covering because they are experiencing more severe lymphedema.
Perfect. And then I will take this one last question about the tactile FlexiTouch Plus pump for head and neck. Do you recommend that to patients?
I yes, sorry. So we have wavering thing. I think it can be adjunct as well. So it's meant to mimic the manual lymphatic drainage that is a tool that we use in what we would call complete decongestive therapy. That is kind of the standard of care for lymphedema. And it's meant to be at home tool for individuals to help to manage that, and it's meant to mimic it. So there's research on that, and I do have patients who may be less inclined or it's more challenging for them to do the manual lymphatic drainage at home, and so it can be a helpful management tool for them in kind of this maintenance phase after we've managed it well with complete decongestive therapy.
Perfect. We've had some really excellent questions, and certainly so lucky to have our experts here and also our Alliance ambassadors. So I wanted to, again, thank Drs. Schmitz and O'Brien, along with our Head and Neck Cancer Alliance ambassadors, Christina Billmire and Chris Nolan, for serving on this panel, providing their insights, their knowledge on the benefits of exercise for head and neck cancer patients and survivors. Also wanted to make sure we thank the Head and Neck Cancer Alliance, the American Head and Neck Cancer Society for their time in organizing and hosting this webinar. We will have a survey for you all, which I believe will be posted or sent in the chat. Thank you again so much for joining and taking the time to be here.